To open an addiction treatment center, you have to clear state licensing, and there are no federal guidelines, so every state plays by its own rules. Because there are no federal guidelines for addiction treatment center licensure, every state's regulatory body is unique. How to open an addiction treatment center, a starting point look at how state licensing works and which agency you'll answer to. We walk through how 9 states handle licensure and the operating system you'll need once you're certified. Before you treat anyone, you have to get the center licensed, and each state assigns that to a different regulatory body. The licensing requirements of each state are different, and each plays by its own rules. The agency that approves you depends entirely on where you open. With the opioid crisis still grinding along, the Post argues now is a great time to open an addiction treatment center. Navigating the licensing requirements of each state is tricky. They are all different with their own procedures, documentation, and governing agency. Some states even split the application by facility type. West Virginia has separate forms for a behavioral health center, an office-based MAT center, and an opioid treatment center. Apply through the wrong body or the wrong form, and you stall before you begin. Identifying the right agency for your state comes first. Once you get the center certified, you'll need a system to manage everything from referrals to intakes to billing to community partners to alumni. Behave Health is an all-in-one, cloud-based software solution designed especially for behavioral health providers. It's designed to support the full operating stack: referrals, intakes, billing, community partners, and alumni after licensing is done. Here's how 4 states handle addiction treatment center licensing, to show just how different each front door really is. If your state isn't here, the lesson still holds. Find the right regulatory body before you fill out a single form. In California, licensure is handled by the Department of Healthcare Services. California's addiction treatment center licensure runs through the Department of Healthcare Services, known as DHCS, which publishes its own application forms and fees. In Florida, it's the Substance Abuse and Mental Health Program. Florida's Substance Abuse and Mental Health Program regulates all addiction treatment providers under Chapters 394 and 397 of the Florida statutes. Florida uses a system called the Provider Licensure and Designation System, or PLADS, to register providers. In Kentucky, licensure runs through the Cabinet for Health and Family Services and the Office of the Inspector General. Kentucky uses different applications and procedures for different types of facilities, so the form you need depends on the program you're opening. Kentucky has one of the highest concentrations of rehab facilities in the country, but also one of the highest overdose rates. In West Virginia, it's the Office of Health Facility Licensure and Certification. West Virginia offers separate applications for a behavioral health center, an office-based medication-assisted treatment center, and an opioid treatment center. Despite a high concentration of detox and rehab centers, West Virginia still has the highest overdose rates in the country. Keep going down the list, and the pattern holds. Every state routes you somewhere different. Arizona's Department of Health Services handles all addiction treatment center licensing and offers an initial checklist to get started. North Dakota processes licensure applications through the Department of Human Services Behavioral Health Division. Montana licenses through the Addictive and Mental Disorders Division and the Chemical Dependency Bureau. Getting licensed is step 1. Then the day-to-day reality of running the center begins, and that's a different problem to solve. Approval gets you the license. After that, the work shifts to managing intakes, billing, partners, and alumni every single day. Behave Health is built to be the operating system for your center once you're certified, designed for behavioral health providers, not adapted from generic software. It's an all-in-one, cloud-based platform designed especially for behavioral health providers, so your team works in a single system. It's designed to support referrals, intakes, billing, community partners, and alumni. The full workflow the Post says a new center has to manage. Because it's purpose-built for behavioral health, it's designed to fit how a treatment center actually operates day to day. Stop piecing together software for a new center. Book a 20-minute demo of the all-in-one platform at behavehealth.com. See the all-in-one system for referrals, intakes, billing, and alumni at behavehealth.com.